This is why you need to know about postpartum bleeding. Understanding what to expect can help you feel more prepared and less anxious during your postpartum recovery. It's a natural process that every new mother goes through, and being informed can make a significant difference in how you manage it. After childbirth, bleeding is totally normal, whether you had a natural delivery or a C-section. This bleeding is your body's way of healing and returning to its pre-pregnancy state. It's important to know the differences in bleeding patterns between a natural delivery and a C-section so you can monitor your recovery effectively. It's called Lochia, and it's your body's way of clearing out leftover tissues and blood. Lochia is a combination of blood, mucus, and uterine tissue. It starts off heavy and gradually decreases over time. Understanding the stages of Lochia can help you know what's normal and when to seek medical advice. For a natural delivery, expect heavy bleeding like a period for the first few days. This initial heavy bleeding is due to the shedding of the uterine lining and the healing of the area where the placenta was attached. It's a crucial part of the healing process, and while it might seem alarming, it's completely normal. It's bright red and might include small clots. These clots are usually no larger than a golf ball. If you notice clots larger than this, it's a good idea to contact your healthcare provider. The bright red color indicates fresh blood, which is typical in the early days postpartum. After about a week, it lightens up and turns pinkish or brown. This change in color signifies that the bleeding is slowing down and the body is continuing to heal. The pinkish or brown discharge is older blood and tissue being expelled from the uterus. This can last up to 6 weeks. The duration of Lochia varies from woman to woman, but it generally tapers off by the 6-week mark. During this time, it's important to monitor the amount and color of the bleeding to ensure it's progressing normally. For a C-section, the bleeding is usually lighter. This is because the surgical procedure involves cleaning out the uterus, which reduces the amount of leftover tissue and blood. However, you will still experience Lochia as your body heals. Bright red at first, then it tapers off to pink or brown over a few weeks. The pattern of bleeding after a C-section is similar to that of a natural delivery, but generally less intense. It's still important to monitor the bleeding and report any concerns to your healthcare provider. Now, let's talk red flags. Knowing what to watch for can help you catch any potential issues early. While most postpartum bleeding is normal, there are certain signs that indicate you should seek medical attention. If you're soaking through a pad in an hour, passing large clots, or if the blood smells foul, call your healthcare provider right away. These could be signs of postpartum hemorrhage or infection, both of which require prompt medical intervention. Fever and dizziness. Seek help ASAP. These symptoms could indicate an infection or other complications that need immediate attention. Don't hesitate to contact your healthcare provider if you experience these symptoms. Most cases are straightforward, but if it's abnormal, treatments might include medication or a quick procedure. Your healthcare provider will determine the best course of action based on the severity and cause of the bleeding. It's important to follow their advice and attend all follow-up appointments. Remember, complications are rare, and with the right care, you'll be on the road to recovery in no time. Most women recover without any issues, but being aware of the signs and symptoms of complications can help ensure a smooth recovery. Got questions? Drop them in the comments below and take care of yourself. Your postpartum recovery is a journey, and it's important to take it one day at a time. Surround yourself with support, ask for help when you need it, and prioritize your well-being. Remember, you're not alone in this, and there are resources and communities available to support you every step of the way. Let's dive deeper into the types, colors, and durations of Lochia. Understanding these details can help you better monitor your recovery and know when to seek medical advice. Remember, every woman's experience is unique, but there are general patterns you can expect. Lochia is typically divided into 3 stages: Lochia rubra, Lochia serosa, and Lochia alba. Lochia rubra. This is the first stage and lasts for about 3 to 4 days postpartum. It's the heaviest and brightest red in color, similar to a heavy menstrual period. You might notice small clots, no larger than a golf ball. This stage involves the shedding of the uterine lining and the healing of the area where the placenta was attached, Lochia serosa. This stage follows Lochia rubra and lasts from around day 4 to day 10. The bleeding lightens up and turns pinkish or brownish. This change in color indicates that the bleeding is slowing down and your body is continuing to heal. The discharge is thinner and less intense than in the first stage, Lochia alba. The final stage can last from the second week up to 6 weeks postpartum. The discharge becomes whitish or yellowish and is much lighter. This stage signifies the end of the healing process, with the uterus returning to its pre-pregnancy state. While these stages are normal, it's crucial to be aware of signs and symptoms of abnormal lochia. These can indicate potential complications and should prompt a call to your healthcare provider. Signs of abnormal lochia: soaking through a pad in an hour or less, passing large clots, larger than a golf ball, foul-smelling discharge, return of bright red bleeding after it has lightened, fever, chills, or dizziness. If you experience any of these symptoms, contact your healthcare provider immediately. These could be signs of postpartum hemorrhage, infection, or other complications that require prompt medical attention. Possible treatments for abnormal lochia: medications. Your healthcare provider might prescribe antibiotics if there's an infection, or medications to help your uterus contract and stop excessive bleeding. Procedures. In some cases, a quick procedure might be necessary to remove any retained placental fragments or to address other issues causing abnormal bleeding. Remember, most postpartum bleeding is normal and part of the healing process. But if you notice anything unusual or concerning, don't hesitate to seek medical advice. Your health and well-being are paramount during this recovery period. Got more questions? Drop them in the comments below and take care of yourself. Your postpartum journey is unique, and staying informed can help you navigate it with confidence and peace of mind.